You've probably heard about it, right? There's this herbal remedy that's been a big deal in traditional medicine for centuries, especially for men's health. But how well does that ancient wisdom actually stack up against modern science? Well, that's what we're here to find out. We're going to dive deep into saw palmetto and ask the big question: is it a legit remedy or just a really persistent myth? So what exactly is this plant that has everyone from ancient healers to today's scientists so intrigued? Let's pull back the curtain and take a good look. Okay, the plant is saw palmetto. Specifically, the remedy is an extract that comes from the fruit of the Serenoa repens tree. Now, this stuff is just packed with things like fatty acids and phytosterols. You can basically think of those as the active ingredients. They're the natural powerhouses that are believed to give saw palmetto all its potential health benefits. And those benefits? Well, they bring us to its #1 claim to fame: prostate health. Seriously, if you've heard of saw palmetto before, this is probably why. So let's really unpack that connection. So as a lot of men get older, they run into a condition called benign prostatic hyperplasia, or BPH for short. And the symptoms? Man, they can be so disruptive. We're talking constant trips to the bathroom, that sudden gotta go now feeling, and a urinary flow that just doesn't cooperate. It's a daily frustration that millions of guys are looking for an answer to. So what's actually going on inside the body? Well, the science points to this one key enzyme called 5-alpha reductase. Its main job is to take testosterone and convert it into a much more potent hormone called DHT. And it's this kind of supercharged DHT that's seen as a primary driver behind the prostate getting larger. And this is where saw palmetto enters the picture. The whole theory is that saw palmetto works by blocking that very enzyme. The idea is if you can block the enzyme, you reduce how much testosterone gets converted into DHT. And that in turn could help slow the prostate's growth and ease all those frustrating urinary symptoms. But wait, the story doesn't stop with the prostate, because that same biological mechanism, blocking that enzyme, has researchers looking into all sorts of other potential uses, from fighting hair loss to helping with hormonal balance. And this chart really lays it all out. For hair loss, it's the same idea, blocking DHT, since DHT is also a major player in hair thinning. Then you've got its potential anti-inflammatory properties, which might help with things like chronic pelvic pain. And researchers are even exploring if its anti-androgen effects could help women with PCOS. But, and this is a big but, take a close look at that research status column. You see words like preliminary, emerging, exploratory. So we are definitely not talking about proven cures here. This is all still very much in the early stages. Okay, with all these potential uses floating around, we absolutely have to talk about safety. If you're even thinking about trying saw palmetto, this next part is for you. Let's kick things off with dosage. In most of the scientific studies, the range they've tested is somewhere between 160 and 320 milligrams per day, and that's usually split into 2 doses. Now, it's really important to see this as a guideline from the research, not some kind of one-size-fits-all prescription. All right, what about side effects? Well, the good news is that for most people, they're pretty mild. We're talking things like a bit of stomach discomfort, maybe a headache, or feeling tired. But it's the potential interactions that you really need to pay attention to. Saw palmetto could interfere with medications like blood thinners or hormone therapies, which is exactly why you have to talk to a doctor before you even think about starting it. And remember this, not all supplements are made the same. The potency can be all over the map from one brand to the next. So to make sure you're getting a good quality product, you'll want to look for companies that are really open about where they get their stuff and how they extract it. And hey, seeing a third-party certification, that's always a great sign that they're taking quality control seriously. This really brings us to the most important takeaway of all, the bottom line. It is so crucial to manage your expectations. Saw palmetto might be a helpful tool for support, but it is not a cure-all. It should never, ever replace professional medical advice or treatment, especially if you're dealing with a serious health condition. So where does all this leave us? Look, saw palmetto clearly shows promise for supporting prostate health, and it has a long history of traditional use to back that up. But when it comes to all those other conditions, the jury's still out. It's an active area of investigation. So is this natural option right for you? Ultimately, that's a personal question, and it's one that's best answered with some careful thought and, most importantly, a real conversation with your healthcare provider.